Aspire to acquire. Hello everyone, this is Jeffrey Leo Christian going to speak on today's topic, hepatitis. The word hepatitis ends with itis, which means inflammation. So the word hepatitis means inflammation of the liver. Hepatitis is usually self-limiting, but in some cases it can lead to fibrosis of the liver, which is also called as scarring of liver, or cirrhosis, and in worst cases it can lead to hepatocellular carcinoma. Hepatitis is caused by both infectious as well as non-infectious conditions. Hepatitis is not only caused by viruses, it can also be caused by bacteria as well as parasites. But in this video, we are predominantly going to see about the viral agents which causes hepatitis. Hepatitis viruses are a group of heterogeneous viruses. They belong to different family. They are diverse in taxonomical arrangement. They cause similar clinical manifestations such as fever, jaundice, vomiting and nausea. They have a common property which is called hepatotrophic. Hepatotrophic means they have high affinity to the liver cells. They all cause acute inflammations and cause identical histopathological lesions to the liver cells. Hepatitis is classified into 6 types. They are hepatitis A, B, C, D, E and F. Hepatitis F in 1994 was thought to be associated with transmission associated hepatitis, but experimental studies failed to prove the existence of the virus. So hepatitis is classified into 5 major types, A to E. In this video we are going to predominantly see about hepatitis A. So without wasting much of your time and with this short intro, let us go directly into the video of hepatitis A. Hepatitis A. It is a vaccine preventable and a communicable disease of the liver. It belongs to the family Picornaviridae. Earlier, it was put under the genus Enterovirus 72, but later it was changed into hepatovirus. Now let us look into the morphology of hepatitis A virus. Hepatitis A virus is 27 to 32 nanometer in size. It is a spherical particle with icosahedral symmetry. It contains linear single-stranded RNA. It has only one serotype and does not cross-react with other hepatoviruses. Now let us look into the mode of transmission. It is transmitted through fecal-oral route and through contaminated food and water and by eating raw or frozen foods. Now let us look into the epidemiology of hepatitis A. It is the most common cause for acute inflammation of liver in children. Host. Humans are considered to be the only host, but in experimental animals such as chimpanzees, hepatitis A virus can be induced. Age. Children and adolescents of 5 to 14 years are more affected, 80 to 95%, but they remain subclinical and excrete viruses in fecus. Adults are more icteric, about 75 to 90% with high mortality rate. Anicteric to icteric ratio of children and adults are as follows. Children's 12:1 and in adults 1:3. Risk factors: poor hygiene and overcrowding. In developing countries, most children of about 90% are infected within the age of 10. In developed countries, the trend shifts to older age, which means the old age people are more affected comparative to children. Now, let us look into the clinical manifestation of hepatitis A infection. Incubation period is about 15 to 45 days. It is sudden in onset. Clinically, hepatitis A infection is indistinguishable from other hepatitis virus infections. It is characterized by both pre-icteric phase and icteric phase. The pre-icteric phase involves mainly the GI symptoms such as nausea and vomiting. It is followed by the icteric phase, which is also called as the jaundice phase, which involves dark urine and yellowish sclera discoloration and mucous membrane discoloration. Complete recovery occurs in about 98% of cases. There is no chronic or carrier state. Rare complications may manifest, including fulminant hepatitis, which involves severe necrosis of hepatocytes, and relapsing hepatitis, which means recurrence of hepatitis after the apparent recovery from acute inflammations. And it also involves cholestatic hepatitis, which includes cholestatic jaundice and pruritus. Pruritus means itching sensation. Now let us look into the laboratory diagnosis for hepatitis A infection. Anti-HAV antibody detection. Now consider this graph. X-axis shows weeks after exposure and Y-axis shows the relative concentration of antibodies against hepatitis A infection. Consider these two antibodies, IgM antibody and IgG antibody. IgM antibodies always appear during an acute infection, and IgG antibodies appear after a week after the appearance of IgM antibodies. So the time interval between IgG and IgM antibodies is 1 week. IgM antibody, consider in this case, it exposes during 3rd week and it attains peak during the 6th week. There is a gap of about 2 weeks in which the liver enzyme is also elevated. IgG appears at the 4th week. So there is a gap of 1 week for the appearance of IgM and IgG. IgM antibodies usually disappears within 3 to 6 months. That consider 14 weeks. But IgG antibodies, after its appearance, it takes decades for its disappearance. So what are the interpretations from this video? Anti-HAV IgM positive. Simple. If IgM is positive, it shows that there is an acute infection of hepatitis A. If IgG is positive but IgM is negative, it means IgG is present and IgM is absent. It shows the patient has past infection or the patient is in recovery phase. Now let us look into the other methods for detection of hepatitis A virus. Detection of hepatitis A virus particle. Hepatitis A virus particle starts to appear in the stool of patients who are experiencing the signs and symptoms of jaundice. And it can also be detected from liver, bile and blood by immunoelectron microscopy. Hepatitis A virus antigen detection. ELISA formatted to detect the antigen from stool sample of patients who are experiencing the signs and symptoms of jaundice. Isolation. It is very difficult to isolate the hepatitis A virus and it is very difficult to grow them in cell lines. But an attempt has been made only in hepatitis A virus considering all other hepatitis virus. Non-specific findings. Elevated liver enzymes and serum bilirubin levels. Now let us look into the treatment for hepatitis A infection. There is no specific treatment or there is no specific antiviral drug for curing this condition. We all know that prevention is better than cure, but usually we don't follow these things. Simple preventive measures will be able to save a life. These preventive measures include hand washing before and after using toilets, since this disease is transmitted through fecal-oral route, and sanitary disposal of fecal infected material with disinfection with 0.5% of hypochlorite solution. Purification of drinking water and adequate chlorination is must. It should be treated with at least 1 mg per liter of residual chlorine, and boiling of water minimum of 5 minutes is required. Vaccination with hepatitis A vaccine is must. It is the best and it is a must. Now let us look into the vaccines for hepatitis A infection. Now what are the eligibility criteria for getting vaccinated? All the children above 1 year can get vaccinated. Travelers to the countries with high or intermediate endemicity of HIV infection. It means the places where HIV infections are common, if you are visiting that place, you can get vaccinated. And the patients with chronic liver disease can also get vaccinated. There are two types of vaccines. First, here we will discuss the first one. Formaldehyde inactivated vaccine and the other is live attenuated vaccine. Formaldehyde inactivated vaccine. It is derived from human fetal lung fibroblast cell lines such as MRC5 and WI38. Now what is the procedure for getting this vaccine? Children above 1 year can get this vaccine. Single dose is administered intramuscularly in the region of deltoid. Booster dose is followed within 6 to 12 months of gap, and the protective efficacy the vaccine provides is 94%. Now let us look into the other vaccine, which is live attenuated vaccine. It is administered as a single dose subcutaneously. It uses H2 and LA1 strains of hepatitis A virus prepared in human diploid cell line in China. The next one is human immunoglobulin HAV-IG. It is used as a post-exposure prophylaxis of intimate contacts of persons with hepatitis A or to the travelers. The dosage required for offering protection for 1 to 2 months is 0.02 ml per kilogram. It gives protection for only 1 to 2 months. should be administered as early as possible within 2 weeks. All the prophylactic medications should be administered as early as possible. Not required for those who are already vaccinated. This brings us to the end of the video of hepatitis A. Hope this video was very helpful to you. And now, what topic should I do next? Please leave it in the comment box. Until then, keep aspiring for acquiring more.